Hello and welcome back. In chapter 13, we're discussing making it in midlife, the biopsychosocial challenges of middle adulthood. So, when we talk about physical changes in health, right, we're talking about turning 40 and how it's usually regarded as the beginning of middle age in the U.S., right? What physical changes start to occur at this age? Common changes include wrinkles, gray hair, male pattern baldness, and weight gain. Challenges to changes to men and women are often interpreted differently. There's less bone mass which occurs after menopause in women and in late life for men. Osteoporosis, disease in which bones become porous and easy to break. Right. This is caused by low bone mass and skeletal maturity. Calcium and vitamin D deficiencies. Right. Can be prevented by getting enough calcium and vitamin D. So protective cartilage in the joints begin to deteriorate in a person's 20s. Osteoarthritis, a disease marked by gradual onset of bone damage and progression and pain disability with minor inflammation. Rheumatoid arthritis, a disease of the joints that affects different joints and causes different types of pain, right? This is more destructive than osteoarthritis. The joints appear to be swollen, can be treated with NSAIDs. Climatic challenges, the biological process during which women pass from their reproductive to non-reproductive years. We talk about menopause, the point to which menstruation stops. Perimenopause, the individual varying time and transition from regular menstruations to menopause. Decrease in hormonal levels can result in hot flashes, night sweats, headaches, mood changes, low libido. Changes women's genital organs to menopause. Thinner vaginal wall and decreased vaginal lubrication can lead to painful intercourse or difficulty reaching orgasms. Is menopause really the end of childbearing, right? In vitro fertilization and fertility drugs can allow post-menopausal women to have children. Estrogen loss after menopause can lead to osteoporosis, cardiovascular disease, and incontinence, right? So menopausal hormone therapy, which is taking low doses of estrogen, often combined with progestin, to counter symptoms associated with menopause. Man experiences less change than women, right? There's a gradual decline in testosterone levels and quantity of sperm. Prostate gland enlarges and becomes stiffer. Need for longer time and stimulation to achieve erection or orgasm. Short and long-term stress becomes most apparent at middle age. Result in financial obligations, worries about losing one's job, marital problems, parents' poor health. Stress and coping paradigm also plays a role. Emphasizes the transactions between a person and his environment. Short-term stress can be beneficial, but long-term can be dangerous to health or even be deadly. Stress may result from the appraisal of events, right? Coping to deal with stress is really important. It's going to be part of our process as counselors to help clients deal with stress and self-regulate. Chronic stress suppresses the immune system, increases risk for arteriosclerosis, and leads to impaired cognitions. Well-known connection between stress and cardiovascular disease. Stress influences how people react and behave. Post-traumatic stress disorder. This is an anxiety disorder that can develop after exposure to terrifying event in which grave physical harm occurred or was threatened. So mindfulness-based stress reduction, right? Again, talk about those abilities to help our clients self-regulate, right? These are mindfulness practices are more up and coming or been shown to be very effective with dealing with people with large amounts of stress, right? This is being aware of non-judgmental of whatever is happening at the moment. Yoga, meditation, result in functional and structural changes in the brain in areas related to control of stress and emotion in areas related to attention, memory, and sensory processing. Aerobic exercise can also be very beneficial, right? It places moderate stress on the heart by maintaining a pulse rate between 60 and 90% and the person's maximum heart rate. 150 minutes of moderate intensity or 75 minutes of vigorous intensity per week is recommended. right? Benefits of exercise: improve cardiovascular functioning and maximum oxygen consumption to lower blood pressure and increase flexibility. So lower levels of stress, better moods, and better cognitive functioning. Points to remember when beginning an exercise program: check with the physician before beginning. Moderation is important. Intent to exercise must be turned into action. Practical intelligence, right? This is the range of skills related to how individuals shape, select, and adapt to their physical and social environments. Does not decline until late life. Highly emotional and instrumental problems are dealt with differently. And problem solving in middle age cannot be characterized in one way. So let's talk about the mechanics of intelligence. These are aspects of intelligence comprising of fluid intelligence, or pragmatic, and the pragmatics of intelligence, which are the aspects of intelligence that reflect from crystallized intelligence, right? So becoming an expert. Everyone becomes an expert at something, right? Work, sports, and relationship, things that are important to you, things that you value, things that you have done over and over your years, right? But we tend to select areas where we want to become experts in and remain amateurs of novices and others, right? What makes experts better? They know alternative ways of problem solving, can bypass steps that the novices need, and flexible, creative ways of with rules. Expert performance tends to peak at middle age and then drops off slightly. Knowledge based on experiences is an important component of expertise. And many companies and professions focus on training employees to learn how to learn rather than focusing on learning specific content. How do professionals stay current in their fields, right? We're talking about continuing education credits, online learning, right? Can adults learn the same ways of younger people? Adult learning is different than adults. Is different in that of adults and whatnot. Need to know why they're learning something before they undertake it. They enter into learning situations with more and different experiences to build on. Prefer to learn things that are necessary for real world problems and are motivated to learn by internal factors rather than external factors. Personality. What behaviors do you think of when you hear something about experiencing when someone is experiencing a midlife crisis, right? There are several competing theories that exist for explaining personality in middle-aged adults. So Costa and McCree research shows 5 dimensions that describe adult personalities, right? Neuroticism. Those high on this dimensions are anxious, hostile, self-conscious, and impulsive. Extroversion, right? We're talking about love, social interaction, talking, and assimilation. Open to experiences. Those in this dimension have a vivid imagination or are willing to try new things. Agreeableness. Those in this dimension are accepting, cooperative, and caring. Conscientiousness. Those high on this dimension tend to be hardworking, ambitious, and energetic, right? The same factors occur across all cultures, right? By age 30, personality traits appear to stop changing and become set. So there's been some longitudinal studies that show individuals change very little in personality traits over 30-year periods with ages 20 to 90. Growing evidence shows that changes may occur over a 30-40-year period. Neuroticism may actually increase and extroversion may decrease with age, right? The 5-factor model is popular and supported with evidence, but it's not perfect, right? Let's talk about generativity, right? This is being productive by helping others to ensure the continuation of society by guiding the next generation, right? This is one of Erickson's stages. Stagnation, state in which people are unable to deal with the needs of their children or provide mentoring. So narrative, right? A way in which persons derives personal meaning from being generative by constructing a life story, right? According to McAdams, generative concern relates to life satisfaction over and overall happiness. Does midlife crisis really exist? So midlife crisis is no more than traumatic than any other developmental stage. Midlife does present unique challenges and issues. We're talking about ego resilience. This was a powerful personality resource that enables someone to handle midlife changes. We talk about family dynamics in middle age. Talking about kin keeper. The person who gathers family members together for celebrations and keeps them in touch with each other, with one another, right? It's the sandwich generation, middle-aged adults who are caught between their competing demands of two generations. We're talking about during the middle age time, one's children tends to leave home. Most parents manage this transition successfully, still provides emotional and financial support if possible, and good kids are seen as successful. A daughter or a daughter-in-law usually takes the responsibility of a caring parent, caring for a parent. There's a filial obligation, a sense of obligation to care for one's parent, and if necessary. The conflict can arise with needing to care for both parents and your own children, and the financial cost associated with caring for a loved one is really high. Caregivers are vulnerable to two main sources of stress: trouble coping with declines in parent functioning, and if caregivers infringes on other responsibility, the situation is likely to be perceived as negative. Feelings of depression, resentment, guilt are experienced by most caregivers at some point. Caregivers need to monitor their own health to avoid burnout. Caregivers has this reward. It brings parents and children closer, provides a sense of giving back. Culture values influence the social support that caregivers receives, and parents are sometimes reluctant to receive help. So let's talk about grandparenthood. Most people become grandparents in their 40s and 50s. How do grandparents interact with grandchildren? Interactions may change over time and be different from grandchildren. Perform societal functions that characterize being a grandparent, and perform functions that gain personal satisfaction. The meaning of grandparent derives from the roles associated with generativity. No matter the grandparenting style, a grandparent finds a meaningful role. Grandchildren value grandparents as a role, builds on artistic beliefs when helping the frail grandparents, and derive both stress and rewards for caretaking. Interaction between grandparents and grandchildren differ from by ethnic group. African American and Latino families value intergenerational relationships. Native American cultures allow people to serve as surrogate grandparents. And Native Americans and Asian Americans grandparents pass on traditions. Finally, there's several stresses that exist regarding raising grandchildren. Financial stress, social isolation, rates of problem behavior in grandchildren are high, and disruptions to one's life own work schedule and commitments.